Mental health has always been a concern in our competitive and stress-producing environment, and COVID has drawn our attention to mental health. It gives me great pleasure to introduce Dr. Diplakshmi R Dhopeshwarkar, who understood how the use of substances were an escape mechanism, and she found appropriate solutions in alternative therapy. Let's listen in on how she has used effective methods in her compassionate work with people who perceive life as difficult and overwhelming. Over to you, Dr. Diplakshmi. We are looking forward to hear from you.
Yeah, thank you so much. Thank you, Atman, for allowing me to be here to give a small presentation.
Pleasure, and thank you so much.
Yeah, so let me share the screen. So I'm Dr. Diplakshmi. I am working as a consultant psychiatrist. Was practicing psychiatry for say more than 20. I'm practicing psychiatry since about 20 years. And something pulled me to learn that there's something much beyond medicines, which needs to be addressed, which is easily ignored in the modern medicine day to day. So that pulled me towards when the day I stepped into hypnotherapy, and that's a journey starting in 2013, and there's no looking back. So how powerful is our mind, which helps us to move ahead in life, in everything. Our thoughts, our emotions, they have a major role in our life. So this journey is started with I did my past life regression, and also I'm sorry to mention, I didn't mention here, I did my Redikall also, and I'm really, really grateful to Atman for making such an easy modality in day-to-day practice. So what do you mean by, let us come to the main topic nowadays, today is addiction, which is easily ignored and which we don't see, which we feel only when there are huge effects. That means a person is addicted. But addiction can also be very much there in every day-to-day life. So let's sum up a few. A disorder that reoccurs and may be harmful to one's bodily, mental health, and social life. So as you see, so we were here, and so a state in which a person persists in using a substance or acting in a certain way despite suffering detrimental effects in their own relationships, relationship with others, physical and mental health, and performance at school or work. A condition that can be managed and treated with proper medicines and psychological measures. So what are the types of addictions that we see? The behavioral, this type of addiction, which is depend on specific personalities, issues like gambling, behaviors, shopping, internet use, etc. And then we go to the substance dependence. This is a type of addiction which is dependent on specific substances. These substances can be alcohol, smoking, as common as food also, which is easily available. Now, the physical, the effects of addiction, which it affects our physical health. So it can lead to health issues like lung problems, heart diseases, liver problems in alcohol, which are certainly seen. Mental health problems are very common with addictions, with which the patient presents generally to us, to a psychiatrist. So there is a high risk of depression, anxiety. There will be agitated behavior also. Because of this behaviors that it can lead to social problems as well. When you need to buy substances, they might pray for the over expenditure, which will lead to financial problems, which affects again leads to legal problems as well in many instances. And there is of course increase of overdose, which can affect day-to-day activity. What are the risk factors that leads to addiction? Now, right now I'm talking clearly from the psychiatric point of view and the medicinal point of view, which we see. I'll later on come to the spiritual or the emotional and mental things. So what we see is the risk factors leading to addiction is genetics, which we say the most common one. Because if we see, alcoholism runs in families. and even factors related to environment, like people in a certain area, so certain socioeconomic strata. There is like shared beliefs of having certain type of intoxicants, which is thought to be normal. Mental health issues, anxiety, depression are very common health issues, which can lead to addiction, wherein a person can just this addiction, this substances can give a temporary relief. Now there are many social factors also. Lack of education is one common thing. Easy access, like easy access, we say like food right now is very easily available in everyday's in everyone's house. You know, if a person is anxious, he can just go to the kitchen, open the cupboard, take the whatever he needs to eat. So these are very common factor. Trauma, to suppress that anger, frustration, and early exposure of drugs also. So why a person can be addicted? So there is repeated exposure to the substances or actions causes brain altercations that make it more difficult to experience pleasure from everyday life, and which this pleasure gets activated whenever you see that substance, or you can smell it. Self-medication is one important thing. Stress, trauma, mental health issues, and family history are very common, which can lead to addictions, and also societal and cultural beliefs. So let's see how a person can, it starts generally with a simple, what do you call, let's try it out thing. So this can go on to a certain period. Like if a person is in a group, a person joins in college, and he or she wants to be in the group. And in that group, those people, the group of people are happy with, they love to drink or smoke. So to be belonged in that group, that person can try to smoke. Then suddenly over a period of time, that person start feeling better. It feels calmed down with that a puff. So at times of sudden stress, he can approach a cigarette, and that sudden stress can lead to anything which is, so that becomes a coping mechanism later on. And this repeated trigger of repetitive stress will lead to repetitive having of cigarettes, and which can form a habit and lead to addiction. So this forms a vicious cycle. So how it starts, as I said, it's like, let's try it out. Let's see what happens. And then you start experimenting more things. So what makes you feel better? And the regular use and this leads to a regular usage. And one fine day, a person can be dependent on it, and addiction occurs. So let us go to the very basics of our mental health. We all know about the conscious mind and the subconscious mind, right? So, so what does the conscious mind? We all know it. It is used for short-term memory, logical thinking, focus, reasoning, and it has a set of rules, which we commonly call as the left brain people, and the subconscious mind, which is connected to our long-term memory, creativity, emotions and feelings, intuitions, habits, and experiences. So what happens is, why a person cannot come out of these addictions. It's a person likes ice creams, okay, or a person. Let's talk about food addiction at this point, which is very common. It's a person is addicted with diabetes, or has increased so much of weight that he is put on a weight loss program. So first day, the doctor mentions him, okay, you have to have a weight management thing. You have to reduce your weight to certain aspect. And so he is like very dedicated and goes home. And on the table, there is some sweet. So the first thing, experience, that experience is stored in the subconscious, which comes up, okay, this ice cream is yummy. This sweet is, I want to have this sweet. But the rule is, the conscious mind says, no, you're not going to have this ice cream or this sweet. So you have to maintain that. The second day he comes, he sees something else on the table, and he's like, the first experience comes up. And later on, but the rule is again there it becomes weak. And again the third day, fourth day, it goes on. And on the fourth or fifth day, he just says, okay, what is the harm in trying a bit of this food or the sweet? And that is where the rule breaks down. Okay. And this is where our healing modalities like hypnotherapy, Redikall, helps us to modify these experiences. So for example, if a person is very happy eating chocolates, when a person is having stress, and most of us, even I have done at one point, we'll just go and grab a bar of chocolate and we'll finish it off full and then feel guilty. So instead of that, we can change and modify this program. Okay, one small piece of chocolate can make you feel happy. So that is where we can use these therapies for us. And as I said, all these emotions are stored in the subconscious mind. The anger, unloved feeling, rejection, frustration, boredom, joy, happiness, love. So there are various folders which are there in our subconscious mind. So the common thing why I pointed this out is, if a person is at times angry, there is a fight. So what we do is we will just go, say for example, if I'm talking about food or a cigarette, so we'll just go out and the person can have a puff of a cigarette. So what are we actually doing? We are suppressing that anger or that rejection or that frustration. So instead of suppressing this, we need to address these emotions. So just like how I discussed, the conscious mind will make a rule to quit smoking, but the subconscious mind is the experience is so beautiful that we need to continue smoking. Okay, so little bit. So how do we address? So yeah, so what are the treatments here? Is first, as a psychiatrist, as a doctor, we would advise a patient to be for hospitalization and rehabilitation, wherein various aspects of the drug substance use, not just smoking, but also we have other uses of opium or into other intoxicants, alcohol, which needs immediate hospitalization. There, we also give medicines which can replace the substance. For example, for smoking, we have these patches. So this is like nicotine patches. We reduce the usage, the amount of nicotine, and that's how we use. But again, we are replacing it. We are not completely taking it out of the system. The other thing is psychotherapists and behavioral therapists are very useful in these type of patients. Now, the beauty is, as a psychiatrist, we have been practicing hypnotherapy, Redikall Healing, which has given us amazing results. And I think we almost all should try these things out instead of not just going for the regular line of treatment. Now, how hypnotherapy works is one I said, we modify the rules. And Redikall is such an amazing modality where you can address your voids with ease. So you don't have to be really under trance or something. Just by proper communication and things like that, it has helped me. So I will just tell you a few examples about how therapies have helped me. So there was this lady who was having cigarettes, almost 20 cigarettes a day for 18 to 20 years. And of course, we are working on many factors. And so one point she comes to me, okay, I am done with it. I have a 4-year-old son. And he just told me, Mama, what do you go and do in that room every time you are there and you do something? And she saw him one day doing some action like this. So that was the day which she looked around and she said, I want to quit smoking. I was like, okay. So with the help of this modalities, the alternative modalities which we use, we did a session on her. And I can tell you proudly, it's 1 year, she hasn't touched even one cigarette. In between, she used to come and tell me, ma'am, I don't feel anything about it. And even if somebody is smoking, there is no craving at all. I say that's a good sign that you are doing it. So, and there is one more example about a person who was on alcohol, and he was, because of his alcohol problem, he had a lot of problems regarding his work, relationships. And one fine day he comes and tells me, okay, I'm done with all of it and I want to have a good, happy life. That is where we started with his therapies. And first day we did a session on him. Next time he comes to me, he's like, okay, I went to the bar, I ordered a glass of whiskey, a peg of whiskey, and then I just went out. I didn't drink it. So that is where, and after the 2-3 sessions, he's completely, and I think it's almost 5-6 years, he's not touched alcohol till then. So okay, so I think it's hanged up and I'm not able to change the screen. Anyway, it's all over now. So if there are any questions or something, please let me know. I think there's some problem. Yeah. I think I'm done with the presentation, Atman. So if anybody has any questions.
That's okay. Now, what you do is just stop sharing the screen for some time.
Yeah.
Perfect. They might want to see you more than your presentation. So that's a natural, we're getting a hint that you speak to people.
Possible.
So have a lovely interaction. I'm just opening up the possibility of them speaking directly to you. Let's have conversation. There's so much to learn from you. Let's grab this opportunity. Okay, so guys, speak to her directly. It would be nice if you raise your hand and then we let you speak. If there are too many people, if just a couple of few questions, I'm sure Dr. Deepa will handle it well. Dr. Deepa, I have a question. How do you handle addiction to healing and spirituality?
Yeah, so thank you, Atman, for this question. So as I said, like I started my journey in medicine, I did psychiatry. And when I was doing psychiatry, I realized medicines will work to a certain limit. So if I say I am getting 95% of the result, what I'm expected. So similarly with addictions, what was happening is like, people would go back. You put a person in rehabilitation center. And then, of course, there is a lot, most of them, there is aggression against the parents or the people who put that person into rehab. So they would go back again and start their addictions. So spirituality, this therapies help me to find the voids, to guide the patients to find their voids, and it allowed them to come out of these addictions with ease. So they need to find, we need to find what is missing in them.
I see. I also come across people who eventually get addicted to therapies, their own therapies.
Yeah. Very common.
Yeah. And meditation also becomes an addiction rather than a constructive way of, evolving.
Right.
That's what I observe occasionally, not always, but it does happen.
Yes. So again, your therapies, it's again a dependency becomes a void. A person who's dependent, constantly dependent on someone to lean on, to cling on, that becomes the necessity. So we need to address that void of dependency. that emotional dependency, physical dependency ki, okay, there is someone to hold my hand on. So once we address this void, it becomes easier. I did have certain people with that feeling. They would every week they would come up and I'm like, boss, you need to understand, you have to take care of yourself. I can guide you to a certain limit. Beyond that, you have to take charge of your life.
I have one question for you, Dr. Diplakshmi. I saw in your presentation that there was something mentioned about food as an addiction. Could you talk a bit about that? Because we have always thought of food as, comfort and nourishment. How can that be associated with addiction?
Yeah. So food is a very potent addiction. Why I say that is easily available. As I mentioned, the things which are easily available are very highly, we think it's that can't help us. Like we take things for granted. So we think that cannot take us to the level of addiction. What happens is, for example, again, there's a fight at home and it's more common with the ladies. Of course, men are not equally there into the ratio. So a person is angry and he just goes to the kitchen and it's easily available. You open the fridge, you have a tub of ice cream, and that person can suppress that anger with that tub of ice cream. Or a person is bored. So what do we do at home? Easily watch TV. So social addiction, social media addiction is very common. So similarly with food is easily available. Which leads to this repeated behavior and consecutive fights. Okay, what is, as you rightly said, it's a comfort food. So comfort can become an addiction. So I think I've answered it. Is there anything on that?
That has been a very interesting point of view. I've never thought about it that way. So thank you so much.
Thank you.
Yeah, good afternoon, Dr. Diplakshmi. I wanted to inquire that, like sometimes addiction leads to obsession also. How do you deal with it as a healer?
Obsession, which kind of obsession are you talking about? Like, can you
obsession of being in that state, he gets comfortable and like so much that if you are trying to put in some thing into his head, they don't want to leave that state. They are very comfortable in that state and they want to get back to that state, and that's why they are addictive to substances or whatever.
So anything, as I said, it's an experience. Okay, when I'm eating food, I love this food. If I'm eating ice cream, I love the ice cream. The experience is stored there in your subconscious, right? So every time I eat food, every time I'm eating ice cream, that experience is triggered. Every time I see a tub of ice cream, that experience is triggered. So every time a person is seeing his friends fagging, smoking, that experience is triggered because that is a good, pleasant experience for that person. So to avoid certain things, as for example, anger or unload feeling, to avoid certain emotions, to face certain emotions, a person can mask these emotions, these feelings with something which gives them a pleasurable experience. So that's why they are stuck into the obsession of being in that high phase.
Okay, thank you so much. Thank you so much.
In the chat, there are some. How does one know that one is getting addicted to something? How do our thoughts affect our mental health?
Yeah, how do we know that someone is getting addicted? Is like, again, when a person is, there is certain boundaries which we make, certain social restrictions, or so certain societal norms, I would say, behavioral changes. So when a substance or a thing is harmful to you or others, it becomes an addiction. So for example, one potent example is food. So we keep on eating food. I'm hungry, even if a person is full, has a proper meal, and again you still feel hungry, that means you're piling on extra calories, and most of the time these addictive foods are extra calories and zero nutrients. So obviously this is going to be harmful for you at certain time. And another thing which is very common is smoking. Smoking is also going to be harmful to you and for others. The latest example which I think we all are facing in our house day to day, thanks to COVID, is media, TV, mobiles. So these are also important. So what are we doing? We are simply wasting our time in doing something which is not giving out some creative results. A person is bored, he will just open up his WhatsApp, and then you go to Netflix, then you go to some other thing, and then you lose out on a lot of time. So you're sabotaging, or you are it's harmful for your career or your relationships. That's how we know that it's coming into addiction.
How do our thoughts affect our mental health?
How do our thoughts? Okay. So the basic things, what is taught in Redikall also. So we have thoughts, and everything that happens in our universe, we only manifest at certain level. So we have emotions. So every thought, whatever has happened in a life at certain level, say for example, something good has happened in a life, so we feel happy about it. Something traumatic has happened, so we feel sad about it, or angry, frustrated, depending upon the situation. Now these are the feelings which are associated with all the situations. So whatever thing you think, even at this moment, say that thing has occurred 10 years back, 20 years back, 30 years back, you can still feel that emotion. Okay. Now this feeling, when it manifests in our body, the physiological changes which occurs in our body due to this feeling is emotion. Now emotion is nothing but energy in motion. So every time you think of a sad event, so you are activating that sadness that settles in your cells. So every time you think of a sad event, you are giving charge, you are taking that charge, and one fine day this emotion manifests, it settles on a physical manifestation. So what are physical manifestations? Your body, your relationships, and money, finances. So these eventually affect on these physical manifestations, and that is where the problem starts. So if this thing has happened 20 years back, and yesterday some event has happened, so that triggers this particular emotion, and it manifests in the form of an illness in the body, disease. When you're not at ease with your thoughts, it's disease. When you start seeing problems in relationships, this is where somewhere we have created it unconsciously at certain level. So this is how it manifests in our body and our mind. This is how the thoughts work.
Yeah, I think thank you for answering. Thank you.
Anything else? Like,
Yeah, I think we've covered most of the questions. How do they contact you if they need to?
yeah, Dr. Diplakshmi, the same spellings. Please, Dr. Diplakshmi, and every Instagram, Facebook, LinkedIn, it's the same.
Okay, wonderful. Yeah, Sena, over to you.
Okay. Thank you so much, Dr. Diplakshmi. You've given us such an awareness about addiction, and with a very simple and useful explanation. Thank you so much.
Thank
I'm
you.
sure we've all benefited, and we've all agreed that this was a very easy to understand presentation. Thank you so much.